If you're interested in this topic, go to pcf.org, but African American men are not likely to see the doctor about this. They don't want to be messed with down there, but I'm telling you, it's going to be a mess if you don't, because this is a cancer that's highly curable. You got to get it early. African American men 2.5 times more likely to die of this if they get it. So I think it's because we're getting there so late. You got to get in early. You got to get it taken care of. And I'm here to tell you, I had the whole thing removed. I've had a big surgery to take care of it. No problems. Erection's good. Urine good. No problem.
Why are men getting it? I don't understand.
It's part of aging. It's a disease of aging.
So that's just it.
It's just a genetic
thing. So there
thing.
are no environmental factors.
No, not really.
So why are African American men disproportionately affected?
I think we need to study it better. I think it's that they're not getting properly screened and detected early enough. I mean, your dad, thank God, did it just right.
Yeah.
I mean, he dodged a bullet by messing around a little bit, but you know, it's a tumor that you can wait on most times when it's low grade. Anyway, if we're aggressive, it was a high grade. It would have been that would have been bad.
Right.
And you know, if it's outside the capsule, if it gets into the bone, it's different treatment. If you're 70 years old, you might get radiation. If you're under 65, you're probably going to get an operation. And if it's even an operation that, again, detects something outside of the capsule of the prostate, you'd get some radiation then, too.
Right.
And it's something that should be, you look forward to a long life, even if you have relatively advanced disease.
Very curable,
very treatable, very curable.
At what age should men go and get screened?
Well, if you have a first-degree relative, meaning a brother, father with prostate cancer diagnosed under the age of 65, you should go at 40. If the rest of us should go at 50. And it's both the, at least please get that damn blood test, the PSA, but you should also have the digital rectal exam, which is what you were saying the men are complaining about. Yeah. I understand. And by the way...
Can you walk us through that, please?
Well,
is it painful?
I'm not going to do it. I have to do it to walk you through it. I'm not going to demonstrate. Listen, you think how much we think about breast cancer and talk about it in our pink ribbons and stuff. This is just as common.
Absolutely.
This is just as common, and even more so as we get older. You know, it's a disease of aging, as I said. And if you are lucky enough to live long enough, you will get this for sure.
Right.
And breast cancer is not nearly as predictable for women. It's potentially more devastating breast cancer. I understand that. I get that. But this is devastating too if you don't get in there early. And by the way, because it's so treatable early, shouldn't we be more aggressive in our stance on this and our screening on it?
That's what I'm saying. I think people are in the dark because we don't hear enough about it.
That's exactly right. The men, you know, we're such babies about it. We don't want to talk about it either as men, as you see.
Right.
But you know, it's a very common condition. 1 in 7, 1 in 6 men are going to get this thing, just like 1 in 6 women get breast cancer.
Right.
And we will be able to do much more with the prostate cancer from a curative standpoint than breast cancer. So we should be much more on top of it.